The Core 360 belt is the best aid to train the abdominal wall. The Core 360 is a patent-pending, first-of-its-kind training belt that helps you move, breathe, and perform better. We use the Core 360 belt with almost every patient at Winchester Spine and Sport. The biofeedback is second to none, and it's an amazing way to teach proper respiration and can be even used during higher-level movements in the gym. Teaching proper respiration is about as fun as a rash, but with the Core 360 belt, you take all the headaches away. Visit core360belt.com and use the code GESTALT for 10% off all belts, Ohmtrack sensors not included. Again, visit core360, core360belt.com and use the code GESTALT for 10% off. Enjoy the episode. All right, everyone. Welcome to another episode of the Gestalt Education Show. Today, we're kind of finishing up our trip here in Breckenridge, Brett, after the DNS Summit, which was just a blast. If you can see behind us, we're getting absolutely pounded with snow right now.
Now. 10 inches of snow right now.
So skiing's going to be a little bit difficult today. But anyway, we had to finish this trip with the one and the only Petra Valouchová. And so Petra is the head PT for the Center of Movement Medicine in Prague, which basically means that you're the top dog. So Pavel's here, Elena, and then you. It's kind of how it sounds to me. So we're so excited to be sitting down, our first Prague school PT, Brett, and someone that's had a huge influence on you.
Oh, yeah. I think, Petra's has done such a good job throughout the years of teaching. She's a very meticulous teacher, which I really like, and she's very, very easy to learn from. I think great teachers are able to take complex concepts and make them, a little more simpler, easier to digest. So I think she's definitely, that's one of her gold medals for sure.
Absolutely. Absolutely. Well, let's kind of start off with Petra. Let's hear it from you. DNS, how does this all get started? Pavel, he's introducing reflex locomotion, you're teaching reflex locomotion, and then where does this DNS piece come into play?
I met Pavel when I was still a student. I studied physical education and physiotherapy, and he was giving us classes about baby development, and it was very much focused on neurology of the babies, how there might be some lesion in the central nervous system and how the patterns changing this way. And then I was accepted to work in a university hospital to work with him. And this still wasn't DNS. It was still looking at the neurophysiology of our movement system, how to also use some manipulation and mobilization treatment. And gradually it became DNS, basically giving their definition and start to grow the DNS exercises, assessment, also more extend the DNS into the fitness field and the sport field. Basically, as I know, when Pavel started to teach, he was very much influenced by Professor Vojta, who taught him what is the basic or natural way of development and how we can look at the principle of movement in our adult patient, in our adult client. And also there was a huge influence from Karl Lewit, well known for manipulation therapy, and Vladimir Janda. So each of them, they were sort of genius. Each of them has a different skills.
Yeah.
So Professor Vojta, he was very detailed in neurophysiology, and he basically invented and discovered how our proprioception is linked to central nervous system and how we can trigger the pattern from the heel or from the elbow or from one part of the pelvis. Then Professor Karl Lewit, he has very good hands, so all that skills, and I think the Prague school, all the PTs you can work with when you come to seminar, we are very, I would say, exact or trying to be very specific with our hand contact and hand guiding. And Professor Vladimir Janda, he has very good eyes. So all the aspects, looking at the client and patient and trying to see that connections and sort of hypnotizing and then monitoring the movement and then trying to treat it and having certain of solution for our patient.
Petra, as time's gone on, early on in DNS and before then, reflex locomotion was a big part of the curriculum in the coursework. And now, not so much, although the principles of developmental kinesiology are obviously still being taught. So what do you think about that transition as instructors we're teaching less reflex locomotion? What do you think about that?
When I talk to Pavel, he's still seeing a lot of regarding understanding the principles, understanding the patterns. It's good. Reflex locomotion is a very good example, or just the basic how to see how brain functions. But when we come to the courses, it's very difficult to basically teach technique in a very short period of time. And even though we really tried for many years, we found out we can have an easy way how to show the students and the people who attend the seminar. So nowadays we showing the same principles, but it doesn't have to be exact spot. It doesn't have to be exact position. We can basically trigger the pattern in any position by giving resistance, giving some guidance. So it's a combination of different cues.
Right.
And it's much more acceptable, understandable for people.
Now, a lot of the people that will be listening to this, they're versed in reflex locomotion and might still use it. How often do you use pure reflex locomotion only now at this point in your career?
Well, when I have a patient who has a difficulty to move himself, so voluntary movement is compromised a lot, the reflex locomotion is a very good tool. And I'm using this method as a concept for many years, and still there's a lot of challenge in it.
Right.
But there are some patients who really need to get the reflex set on the muscles who are not under the voluntary control, and
right.
then have a good success with it then.
Right. And what inspired you? Was it just being around Pavel? So what made you want to go down this DNS pathway, or you didn't have a choice, you had to? Or
I think it started when I just was accepted to work as a regular PT in hospital, and I was keen on doing a lot of new stuff, so I was filming the patient and trying to do different assessment. And by the way, I was lucky to come across Pavel's work, and I was lucky and happy nowadays that still I can be in a current of the DNS.
I think what's hard too for people to understand is a lot of people think DNS is just a bunch of baby exercises. And I feel like when you're around you guys and Pavel, you see that there is so much complexity that is possible that we could be working with our patients from a neurophysiologic standpoint, a neurologic standpoint, all of those things. It's kind of like looking out into the ocean in a way. So what would you say to, because that's one of the things that people say, well, DNS is just a bunch of baby exercises. What would you say to somebody who says that?
I would say that if you look at the biomechanics of the motion, what we do all day long is the getting up or moving forward or turning around. And all the movements we not being aware that it is certain biomechanics we have, and we, all of us as we are healthy, we walking on bipedal locomotion, we have all that components as we developed our motor patterns. And when you look at the development of the child, you see very precise biomechanics of the movement. So if the child has no ability to shift the weight, to load the foot, to transit, they will not do it. So basically, it's all our daily movements from minimal to the maximal performance. It's hidden in it.
Now, kind of along the same lines, some of the critics of DNS, they say that, but now that we've aged, your anthropometrics are now different. We just have, the body's in a different situation than it was in the first year of life. Why would we want to be returning back to these positions of development? We all know why we do it, but I think it'd be good thing to talk about. So what is the reason or the justification for going back to the first year development to exercise our older patients in?
The thing is that with the development, any phase, we in some time of our life we getting more advanced, so we developing our motor skills and motor patterns, and then in some time we start a little bit a little bit diminish them, or we talk about the motor deprivation. So you're not using some motor patterns, some movements, and your brain is going to forget.
Right.
And to give your client, either the patient or the athlete, you're giving back the variety.
Yeah, and I always use the analogy of like, if your computer stops working, what do? You hit Control-Alt-Delete on your computer, so that's always a justification that we use oftentimes in our offices. We're kind of rebooting the system and going back to the original. And saying that too, I think we sometimes skip over the fact that we have so much to offer in DNS with the pediatric patient that isn't developing physiologically the way that we want. Could you maybe speak of how like that is kind of the bedrock of DNS instruction? Like we do sport courses and things like that, but also, I mean, we have a lot to offer to the pediatric patient that really in the United States, I feel like we're really far behind in the treatment of our pediatric patients compared to what you guys are doing in Prague.
Yeah. What I see when I'm teaching pediatric courses all around the world, I see there is I think it's not difficult to implement the physiological neurodevelopment in any phase of the child development, from newborn up to maybe 15 years of age. And sometimes I think that the therapy is being focused more locally. For instance, if the child has a hip dysplasia, that's it's focusing about hip itself. But in order to improve or treat a hip dysplasia, when we look at the patterns, we have to also focus on the foot. We have to also focus on the torso, or on the core. We shouldn't forget that the part of the development is the locomotion which involves the upper extremities, upper quadrant. So in this way of thinking, this might be very helpful.
Mm-hmm. Right. One of the main tenets that we teach at DNS is joint centration or joint decentration. Mm-hmm. And some of the critics of DNS also will say that when athletes are on the field, they get in positions of decentration, and that's kind of like an argument against DNS that we're always forced to kind of answer that. So when somebody is refuting the fact that joint centration is important because there's not exactly research papers to show that, how would you combat that argument?
Yeah. Again, if I will look back at a child development, the child will never use the decentrated position to get up or to move. It will just find a different way, different detour. While the truth is, in a sport, we cannot avoid the positions which are not perfect. But what is important that we are, during that movement, our brain is able to get us from the less efficient position, in the DNS terminology decentrated, to the more efficient position. So if you are a longer time in knee valgosity, this takes, again, for the brain, longer time to get out of it. So then you losing the speed, and you will be never as powerful, or you cannot exert as much force in that less convenient, less efficient position.
Now, and I mean, we have our DNS poster children that we love, like Federer and others. Now, if you teach long enough like we have, you'll have someone in the room pull up some other pictures of you. So if we went with the knee valgosity example, the one that everyone likes to throw back at us is Usain Bolt, the famous sprinter. How there's moments in his, sprinting where he's in quite a bit of knee valgosity, quite a bit of pronation in the feet. And one argument could be that, when you're at that level, they're just such outliers that it really doesn't matter. But what do you think about the great performers or movers that are not exactly in our perfect DNS window that we always talk about?
Yeah, I think it's very individual. The top athletes, there it's on a Gauss curve. Is it the right expression? Yeah. They're like 5% of the whole population. So they have not only special skills, but also soft tissue tolerance. How much they join the cartilage that ligaments can take. Basically, also via the training, they're loading the tissue. In some time period gets stronger. But there might be some breaking point when it's not enough, or the tissue will crack or collapse.
Yeah, and if you were working with Usain Bolt, you could probably also take that, and you might be doing some different things in DNS therapy to maybe like have an insurance policy to make sure you might. Because I always think about that in baseball. When I see mechanics I don't like, I might not specifically be wanting to change those mechanics, but it might change how I'm treating them to hopefully, DNS has also became kind of famous for our idea on the abdominal wall. We kind of think that we're right on what's going on with the abdominal wall. Could you maybe speak of how that's all evolved within DNS? Because I think like the thing that we got to give Pavel credit for is, although in like previous literature and research, people were talking about intra-abdominal pressure and people were talking about the diaphragm being a stabilizer of the spine, but I don't think it really got showcased until Pavel started actually like demonstrating it. Like even in Paul Hodges' work, like you can find like where he was talking about it, but I think you guys and Pavel have done by far the best job of showing what this actually means with our patients.
Yeah. The thing is that when we do any movement, I will explain a little bit more generally. Whatever we do, we automatically stabilize. So there is automatic regulation of our core muscles. So it's very something happening pre-programmed. It's subconscious.
Yeah.
And basically when I'm working the clients either doing some sport and they would like to get better or they got injured, I'm telling them that now they would like to do core exercises. Yeah, and now we will come to the topic, what about bracing or IAP? But I say whatever exercise you do and you are having certain the pattern your brain is focusing on, the stabilization is there by itself. But when it's getting compromised, we have to find a sort of a key to like restart it.
Yeah.
Right.
And basically, what I know from our courses, the introductory course or level A or exercise 1, we very much paid a lot of attention of the trunk muscles activity and coactivity. Sometimes it's leading our students to think only about diaphragm and only about the core and IEP, but we have to then basically integrate it in our movement system in whole complexity. And it's sometimes a state of the art because each our student needs to also develop in the way of thinking and way of treating the patient, and it takes time.
I always tell a really embarrassing story about myself when I was working with one of the best hitters in baseball, and so I worked with him a month. He had a really bad oblique injury. So we get done. I mean, I'd spent 2 hours a day with him basically over a long period of time trying to, teach him, what we're talking about. And then at the end of all of that, he basically has his shirt off, grabs his bat, and he's acting like he's, going through a swinging motion. And everything that I had taught him had now basically gone away. So what do you think, Petra? And I mean, this has been one of my difficulties for sure, would be you teach it to him on the table in DNS exercise. Maybe you teach these concepts with them in strength and conditioning. And then there's like this next level, which would be integrating it into their actual sport. Can you talk about like how you make that transition from like the table or strength and conditioning into the athlete actually understanding what this feels like in their body?
But I think what you just mentioned your story.
Yeah.
I think it's absolutely fine, because when we train, when we do exercise, when we treat, the patient focus, so he can control the movement because it's slow and it's way of learning it. Yeah. So the motor learning. But when you come to the game, the brain, your right and left hemisphere changing a little bit the control. So during the game, you're using your right hemisphere, which is just setting the whole complexity. So it's no way to focus on one single thing. So we basically, what we do in treatment, I don't mind if the patient or my athlete I'm treating, like on the field, is not doing exactly what we basically were focusing on, but his body has more variability. So even though one shot, not good form, it doesn't mean big things.
That we've done a horrible job.
Yes. So
you
you're getting basically his body to be more adaptive, more variety of movement. So, and also it takes a time. And we see in a practice that if you have an athlete and you start to work with him, it takes a couple of months to just get him to good form, or basically change of muscle tension and better compliance of the muscle coordination, and it will also take some time to put it into more automatic way of using it. So we talking about not 3 months, maybe 6 months, 1 year. So it's a little bit long journey, but regarding to like saving our soft tissue, ligament and cartilage, it's worth it.
I think too, we always talk about, training intra-abdominal pressure, like especially in our coursework before we initiate movement. And on the athletic field, like if you're an NHL goalie, you got to have this stabilized in a second.
Yeah.
So then I think like that offers another opportunity in DNS where we can actually train intra-abdominal pressure with reaction, because I think that's a little bit different. It's one thing to, I got to get prepared to deadlift weight versus, I'm a goalie and now I need to react.
Yeah, well, it really depend on each sport specificity. So
Right.
it's very depend. You have different way of different cues how to treat it on. But again, when we do the sport, when you basically run and jump, your focus is not very much about you, like how you breathe and how you stabilize. This they're becoming automatically. So we can trade like artificially away from the real sport, but you're getting the muscles sort of being aware of it. Like, there is the ability to being involved in some specific situation, but it's very automatic, and it's hard, and how to transit it purely.
And that's a really good point, because they did research on sprinters and they found that if the athlete has to think about a cue within their body, then it actually harms their overall performance. So,
Absolutely.
and I think that's an understated point. So we've talked about joint centration. We've talked about abdominal wall function. I think one of the third big tenets of DNS is multisensory integration. So, and I think DNS has done a very good job of explaining the neurology of what that actually means. Could you comment on the importance of multisensory integration for our athletes and our patients, and why that actually is an important concept?
Yeah, well, I think it's basic of our movement, because if we cannot perceive our body, our brain has not information where we are in a space, so we cannot basically fine-tune the motion, and so it's I think it's basic to work on the sensory stimulation and also tactile and all the basically periphery joints, hands, feet. It's very stimulating. It's enhancing our patterns to become effective or powerful.
Right. You have a huge experience with the running community. You teach DNS running seminars and things like that. What are some of the DNS ideas on running technique? And I'll tee this up for you. Like, everything that gets debated in America is, should we rear foot strike? Should we midfoot strike? Should we forefoot strike?
Where's cadence? Where's
the strike point at? Like, what are some of the things that you think are important for looking at the runner?
Yeah, so as the gait, walking is natural movement of our body. So nobody is teaching the child how to land the heel strike. So the continuation of development, how we stand up, the way we walk, the same way we run. And there are some details how we basically move our hips, how we move our torso. It's very influenced what is our foot is doing. So the consideration about heel strike or forefoot strike, we have to look at the whole body, how we swing the leg, the same way we will land. If we swing the leg, the other leg is supporting. So the supporting function of the other leg and all the alignment of the rest of the body is very decisive how I will land my foot. And what I see frequently, that if someone is like patient is coming and they say, well, how should I land my foot? And I'm saying it doesn't matter. It's just you think of propulsion forward. Sometimes it's maybe if there is injury, maybe the most frequent injuries are Achilles and foot and knees. So then we have to much more focus on what is above, what is the pelvis and hips are doing. So, but naturally, if you look at the different runners, they run the way what his body is offering him. What is his anatomy, what is his kinesiology, what the tissue allows him to do.
Right.
So then sometimes you have to forget about what the foot is doing and start from the more cranial proximal segments.
What about, would you ever change somebody's strike point? Say you have a runner in the middle of a season that has symptoms. Would you ever be concerned about that, or you're still looking proximal in those?
No, I give you one example. I had a patient who came and he ran ultramarathons quite a lot, and then he came with both Achilles pain and tendonitis, and he was saying that he ran 50K, I don't know how much mile it is, 50 and 100, a lot every weekend. And once he never seen himself running. He was comfortable, he could run for many hours. And once his girlfriend was filming him during the running, and he just was so shocked that he looked awkward. He looked terrible, and he said, well, I was so much heel strike, and he said, I don't want to run like this because, it looked terrible and heel strike was not good. So he switched into the barefoot shoes like this, I'm just buying the barefoot shoes and I'm going to change my strike. And within 1 year, he totally damage his Achilles tendons. So if we plan, or if there is some chance to change something, it has to be good timing. Definitely not in a season, but it needs long time.
Slow changes.
Slow changes, exactly. Yeah. So you have gradually to go B's and B's, and frequently I'm saying that as we have certain anatomy, certain architecture of our foot, knee and hip and the rest of the body, or even shoulder, it's giving us how our running style will be.
Right.
So it's no way that we will, your arm is doing this and that, and you should change it, you should do something else with the hand, with the arm. We have to be very sensitive to any those big corrections.
And that's exactly, we've had Thomas Michaud on this podcast who wrote the book Human Locomotion, and he would agree with what you just said 100%. How often are you integrating other ideas or concepts outside of DNS? I know talking to some of the other Prague instructors, some of you have gone through Stecco's fascial manipulation, and is that a common thing that you're using other things, or are you pretty much a purist in DNS 100%?
Yeah, it is. It's empirical, but not every patient react the same stimulus or same guiding, and depending, you have different variety of the diagnosis, different variety of the anatomy of our patient, and then you also have to think what else you can offer.
Right.
So besides the DNS exercises, I like to use a lot of soft tissue stuff and other method and concepts. So we do combination of different approaches.
I think now, because of COVID and just with Pavel getting older, he doesn't travel like he used to, so not everyone gets exposure to Pavel. Could you, in your best way, kind of describe what the magic of Pavel Kolář is? What is his gold medal? What is he doing so much better than everybody else? He's genius, as I said. He has. I think we have 5 senses, and he has 6 senses, and somehow the reasoning is amazing. So he learned, as I mentioned, observation very well. He has very good hands, and he also the way of. One thing is very important, that he has very good communication with the patient. He can explain the patient with any background. The way the patient get into the basically compliance or willing to treat himself. So it's very important. It's not like I'm here, doc, and I'm treating you and it's according to me, but he get a skill in each athlete or patient to explain them so well that they starting to understand their own body. And I think it's very, very important regarding basically individual treatment. And even though he's not traveling to teach as much, he has a bunch of patients every day. I just can't understand how he can do it. And such a wide variety of patients. I think one thing I always enamored with him is that it could be a pediatric patient, it could be a professional athlete, it could be someone who's got neurologic compromise. and he's just so good in all those different areas.
Yeah, I think, I'm saying he's genius in it. So we have still a lot to learn from him.
Right.
Absolutely.
Future?
Yeah, so let's talk about the future of DNS. So obviously, I mean, relatively DNS is pretty young. I mean, in the grand scheme of things, I mean,
it's in its infancy.
Yeah, really.
It's only 15-ish years old.
And I feel like in the last 5 years, the education piece has gotten much better. The courses are getting better. The teachings are a little bit more congruent, just from a student's perspective on myself. So what's the next 5-10 years of DNS, Petra?
I'm not sure if I'm the right person to talk about future, but as far as we talk with Pavel, we have some seminars for our as instructors. What is the big concern of Pavel is to keep the basic roots of the DNS, explaining that it's not something that Professor Kollár made it up. It's our neurophysiology. It's basically how our body and brain works, and we need to keep it, even though there are courses which are more specific, like we had a gait or we have a shoulder, and there is specific for something else. So we should still keep this basic message of the DNS concept that according to him. And what I see in a work of a whole group, whole team, is to, as you mentioned, to make all the teaching process for students much more easy to digest, easy to basically implement, apply with the patients.
I think too, like for the students, a good takeaway idea is basically every patient that you see from now on will be through a DNS lens. You may not be using exact DNS, exercise therapy, but you'll always look at every patient with the lens of DNS, and I think it offers the explanation for why you might have joint blockage, trigger points, abnormal tension, tone, and muscles. And that's what I love about DNS, because it just is an overreaching umbrella to everything, basically.
Yeah, you're exactly right. And what Pavel is saying frequently, that DNS is not like a technique for such a thing, so for certain diagnosis, and if you applying the principles, you can do any exercise. You can apply it for, even though Pilates, or we have our colleague who is doing yoga and applying, basically when you using the principles, that's you get much better result.
Yeah, for sure.
Brett said it once to me early on, and one of the first times I heard him talk, any exercise can be a DNS exercise, which is just what you said. And so that's something I always remind ourselves, our trainers in our gym. It doesn't matter who we're talking to. That's what's so cool with DNS, like you said. So.
Yeah, It's DNS when done well. It's just the most powerful thing that exists in rehabilitation. Yeah. So, and no one could convince me differently of that. Like it's just too powerful.
One of the things that we always get questions about too is like, well, are you actually doing DNS with your older patients? Are you actually doing DNS with your younger patients? And the answer is yes. I mean, yes, you are. Again, the principles apply, and that's the nice thing with the more coursework you go through and the more different instructors you see, the more little modifications you get for that specific patient or that population, and that makes it so exciting to come to weekends like this for. 3 instructors in Breckenridge, Colorado. What more could you ask for? So little pieces here and there, and it was awesome. This is another great time of learning for Petra, and I'm forever thankful for your teaching and for coming over here. And
my pleasure.
Yeah, we just really appreciate you. So, any final thoughts, Brett?
No, I think I overheard you saying you'll be in Vancouver later this year. Yes. Teaching for Mike. So if you want to see Petra specifically, she's got that course coming, and then we'll be back here in a year. So that's the other thing.
And then so what we didn't mention is Petra's PhD is in gait, and so what better person to teach gait and running than someone that's literally devoted their life to it. So we're really excited to learn from you next year, and thank you very much. Appreciate it.
Thanks, Petra. Great job.
Thank you so much. Yep. All right, guys. Keep assessing your patients, and hit up a DNS course. It'll change your life. There's no question. I hope you enjoyed this episode of the Gestalt Education Show. If you liked it, share it, subscribe to it, send it to your friends, send it to someone that needs to hear this message. We really want everyone to be able to tune in and get the best clinical advice that they can, which we're hoping that we're giving to you with these special guests. So if you have any questions, please feel free to reach out to us, or if you have any suggestions on upcoming conversations, let us know. For a list of our upcoming courses, we're adding them all the dang time. So go to gestaltedu.com, click on courses, and they'll all be right there for you. All right, have a good day.